to really engage. Yeah, that's right. You skipped the most important part.
Keeping you on your toes.
And so, and we'll, you know, continue to do these spotlights. I think that's, you know, that's been a great opportunity to dive a little bit deeper into, you know, some of the partners we work with. We'll host the first quarterly learning session on vital conditions themes, and so that's bringing in speakers and, you know, focusing on one of the themes. And this first one is, looks like it's on tax day. And then we'll support partner convenings and other gatherings and discussions. You know, really in that vein of coordinating and bringing people together and having good discussions to move this forward. The next slide, the second objective of this priority is providing partners with insight into where well-being is improving, where opportunities for change still remain, by really assessing community needs and you know, trying to strengthen our data collection and sharing. And as John mentioned, these well-being dialogues that Sarah hosted for the DOH environmental health disparities mapping, just in Q1, there were 16 of those dialogues. And so that was across, you know, the entire region. There's, I think, a lot of travel involved in those. We've had 6 data sets added to the data inventory, and you'll see some updates soon on the website to reflect that. There was one newsletter that highlighted some data updates, and it had more views than usual, than most of the links that we include. There were over 100 clicks to check out the data. So there's definitely interest in learning, you know, about what's going on in the area of well-being. And then there are also more than 48,000 views, and this is based on the social media analytics through all of our social media channels. So that's an impressive number. And then we're continually working on updates. Morgan is working with the team, you know, to continually keep the content fresh and current, and in this case, focusing on different vital conditions themes as well. And then for the plans, this quarter, the town hall, John mentioned that'll essentially conclude the DOH disparities mapping. And just, yeah, to note this, on April 17th, I think that's when that is the big event. So, you know, everybody's invited, and it's an opportunity to share more information, but also I think to share out some of the results to the community. And then we'll be providing wellness data updates and resources on the website, as I mentioned, and developing, and we're doing this as a team, developing a centralized performance and impact data management system. So these are some thoughts we've been throwing around on how to best centralize, you know, all these important data points and collect them so that we continually, you know, have easy access to see cumulatively what we're accomplishing, but also to be able to share, you know, to share that information out. The third objective of this priority is to make strategic coordinated investments, designing essentially strategies to help create a more equitable community region. So we've had strategic partner contracts signed with the CHIs, Coalitions for Health Improvement, and other partners. 6 design team meetings. Criteria development has been underway for the next funding cycle initiative. And with that, you know, there will be more of a focus on upstream. And so that's kind of the shift in design work. The plans for Q2 to support, you know, continually to meet, and I think we mentioned this with OVOF, et cetera, with other partners, participating in ongoing civic design team meetings, and then complete the rollout of that grant making process. And then there's a fourth objective, which is somewhat related, but it's, you know, with these with this design is to prioritize resources and invest in these proactive solutions. And just want to mention that so far this year, this quarter, we quarter one sponsored 7 community events. We've had prevention and recovery coalitions that we've participated in. There's a Be There campaign that we've been rolled out, and a full-length documentary that is the rough cut was completed in quarter one. This is focusing on. This has actually been quite an impressive effort. I was able to watch the rough cut. I think it's not publicly available yet until it's complete next quarter. But you know, really covering a lot of the region, interviewing a lot of people and recovery coaches, and this is something that should be completed. At least that's the aim for next quarter. And you know, in some ways, if any of this feels like it may not tie directly to a specific objective, I think there's a lot of overlap, you know, in work that we do that actually supports all of these objectives and priorities. So this is where I felt I would share this point about the documentary. And then in quarter two, we'll be doing, actually Morgan's working with the library system to do a video spotlight. And that will involve a lot of interviews with local residents and also highlighting some of the resources that the library system offers, you know, including some things that we've supported with the digital equity and with the Narcan machines, et cetera. And then of course, where some of the event sponsorships involve Earth Day or Earth Month, actually. Yeah, okay, and I think then the final slide for this first priority, which is why you need to step this up, was that we'd have increased outreach, systems change, expanded networks, and use of storytelling. So before I move on to the next priority, any questions or comments? Okay.
Can I just quickly, when we're trying to share this back to, I recognize that some of these are still process type measures and we'll continue to work and refine this, but this was part of an ask also from the board. It's like understand how our work is more tied to our strategic priorities. So this is kind of a first cut into that, and we'll continue to kind of update and refine these updates as we go along.
Perfect. Yeah. All right, next slide. The second priority is strengthening belonging and civic muscle, and that's to provide learning, investment, and advocacy opportunities to strengthen belonging and civic muscle throughout the region. There are 3 objectives associated with that priority. Sharing power with marginalized communities, improving organizational capacity, and then committing to that belonging and civic muscle. The first objective is centered around engaging marginalized communities and sharing power to address disparities. So here's some more numbers that I wanted to share. 276 community members participated in those well-being dialogues across the region. Now that was quarter one. I think John gave a higher number because we've already now surpassed that going into quarter two. So, you know, at the bottom there, just, you know, for quarter two plans, there will be hundreds more after finishing up these other dialogues and the town hall. We've also had 3 behavioral health education videos that were released that are focused on 3 different community members and their recovery journey. And they're very powerful. And we created a media toolkit to go along with that so that partners could share out those videos and in both English and Spanish, the toolkit and just provided some guidelines on how to post it through social media, et cetera. It's had a lot of response, a lot of positive response. And then there's some other public outreach materials as well that we've been translating to Spanish. And then, as John mentioned, the eighth Narcan machine. I think actually there's a nice map on our website that shows the location of all of them. But this most recent one that's placed at the Moses Lake Library, just in since it was placed late last year, there were 500 cans distributed and 12 overdose reversals, which, as I understand, is 3 times as many overdose reversals, lives saved as our other locations. So it has actually had a true impact. And as you heard earlier, continuing with those discussions to try to maintain it and figure out how to move forward with that. Also wanted to mention that for Q2 planning, the additional Narcan machines, there's another one in Grant County, I believe, and then also across the Colville Reservation. So they contacted Joey, and with their own funding, the tribe is requesting to have machines placed in various locations across the whole reservation, so it's good. And then we'll, continue the surveys are collected with each machine, so Joey has a lot more information on the data that he can share with Narcan use and the overdose prevention. The second objective is enhancing the organizational and collective capacity of our partners, and this is essentially the training capacity building, excuse me, that Mariah coordinates and leads, and she held the conflict resolution, de-escalation training. That was something actually that Wendy recognized as it was highly sought after across, multiple locations. People were asking for this type of help, this type of skill building. So that was actually so popular that there was a waiting list, and then those individuals will now participate in a future training. In fact, there'll be one in each region throughout the year. And then there's been a significant increase in the use of the Catch a Fire resources that we've offered to partners that Veronica will speak to later. And or maybe Mariah will speak to that. And then we've had a press release, and you've heard of the Rural Health Conference that Wendy and Joey presented at. And then the Q2 plans, I just wanted to point out all of the training events that we have scheduled for this quarter alone, which is quite significant. So the grant writing that was finished up last week, and the mental health first aid training, which is another one that was requested, very popular. And recovery coach training, which we've had in the past, and also includes the week-long in-person academy later in the quarter, the motivational interviewing, and then the Take Care of Your Heart retreat. That was initially designed for the recovery coaches to, essentially self-care, compassion, fatigue, to help individuals, working in challenging, social care to take care of themselves. And we're, realizing that a lot of our partners need that kind of support. So Teresa's been working hard to get that scheduled for Leavenworth in May. And then we'll have one for the recovery coaches later in the year. And then the third objective under this priority is increasing the number of stewards who commit to to expanding this belonging and civic engagement. And we've spoken about quite a bit about the advocacy work, and I feel like, a lot of that kind of initiated with that visit to Olympia back in February, early February. And there were several partners, Teresa organized a bus for us and got us all over there. And, for me, it was extremely educational. I think it was for a lot of folks. And just learning how things work in Olympia, being able to visit with some of our legislators and see, tour the Capitol. And then in addition, this is where I decided to note the conference room, that this extensive space that's so lovely, besides the actual construction, Teresa did a great job of actually getting it prepared and comfortable for our partners to use, and it has been used already, usually evening events, but so it's nice to be able to offer that space. Okay, and then just to summarize the impacts that we're expecting, and again, I'm not necessarily sharing, so the next slide, please. Oh, I guess I didn't talk about the plans, but yeah, you can go to the next slide. The expected impacts. And this is the type of, impact data that we'll be collecting, but we really do want to see an increase in engagement, and I think even with, the testifying and the letters, I mean, that really does speak to it. And strengthening the community-based organizations where anytime, where we organize a training, for example, Mariah ensures that there's a survey so that we can gather data, information, feedback on how it went, but also how much, the individuals felt they learned, how much they're able to take back to their organizations and, and use it in their work. Okay, and then the third priority is to improve and connect systems of care with the goal to support collaborative efforts that improve and connect systems of care across clinical and community settings. And the 3 objectives associated with that: equipping the workforce in clinical and community-based care, enhancing organizational capacity to increase coordination, and to increase access to vital resources for all residents. The first objective associated with this third strategy is to essentially ensure that the community-based and clinical workforces are well equipped and well compensated. And so that's, creating a pipeline of trained, workforce. So some of the accomplishments, sorry, I'm starting to lose my voice, was that we've engaged with the Washington State Health Workforce Council to really advocate for rural health workers. And I understand that this council does some advocacy as well, which is really critical. We've had 26 applications for a new Bachelor of Applied Science degree in behavioral health. And just to jump down to the plans, below related to that is that the first cohort will be selected. So applications are still being accepted, but the cohort will start in 2025 this year for that new degree in behavioral health to help build the workforce pipeline. And then third
is that through Washington State?
It's being offered through 2 colleges, Wenatchee Valley College and Big Bend Community College.
Yeah. Hi, I'm jumping in here. So yeah, they got the grant like a year or 2 ago to build this. And so Wenatchee Valley College and Big Bend are co-hosting this together. Right now, Wenatchee Valley College already has its cohorts set and are doing interviews for it for this fall. And Grant County, I think they're still looking and still taking applications at Big Bend.
Thank you. Wendy, did you have anything else to add?
Nope, Ruben summed it up pretty nicely. I could say that Big Bend has almost, I haven't heard the updated numbers, but they tend to see their applications for their bachelor's degree closer to their graduation. So they're very hopeful that they will fill their cohort as well.
Okay. And then the third point on there is that there's a protocol being developed for the certified peer specialist training. And that is so that it can be considered a career and technical education CTE class. And once that protocol is approved, it'll be distributed to all of the CTE directors across the state. Are there any questions on that or anything to add?
Nope, no, and that CTE classes are in high schools.
All right. Second objective of this priority is to enhance the organizational capacity for information exchange and care coordination. So some of the highlights, so there are 2 large contracts that were signed with Hub Partners. And these are one of the longest contracts I've ever seen, including budgets, reporting detail. So Caroline put a lot of time developing these with those partners. Also working closely with Morgan to help create a lot of outreach materials. So this is the various rack cards and flyers and this dedicated website and newsletter, really to help keep informed of all the partners. Been 4 work planning sessions, community advisory meetings. There was a mental health triage pilot that apparently was so successful, has been so successful that they just hired a second social worker. And they added their 100% satisfied. So Wendy has a lot more data on this. But you know, of the majority were very satisfied. They were either 100% were either very satisfied or satisfied. So that's a good testament to the program. And then they surveyed emergency department staff to assess. Is that the same? That would be the same. To assess success and satisfaction. And then finally, there was a DOH contract, fiscal audit. You know, that's you know, an administrative thing, but it's always a little scary when you have auditors come by. So I think we did okay there. And then the healthcare authority and first quarterly report was just submitted. And then for Q2, the client referral management system development and implementation, that is something that is big effort. Caroline's working hard on with the partners, and those data ultimately will be able to share with the healthcare authority. Continuing to increase the outreach. And the goal, you know, since this was first started and a lot of time and effort put into setting up systems, IT infrastructure, what the goal is to expand from 130 clients so far up to 1,400 clients per year to be reached. And we'll continue to share out the network dedicated monthly newsletter and continue doing public outreach. Caroline, was there anything you wanted to add on that? And I'm
Nope.
flying through these last ones. Okay. And then the third objective of this priority is increased access, ensuring all residents have access to the resources that they need. And so here, this is somewhat related to the last slide, but we've had 119 referrals and 139 lives served. That number is probably increased by now, but that was in that quarter by the Community Connect and Recovery Coaching. Signed, John mentioned this, signed a contract to support the Okanagan hospitals. Telehealth and digital equity impact data is being compiled. Wendy's been presenting. New fiscal agent agreement. I wasn't sure where to put this, but I included this in here. It's intended to, help to improve the coordination among the ACHs, so that the coalition of ACHs. So Thriving Together is serving as, and I think I spoke about this before, but the systems are now set up so that we can financially manage the coalition and help to improve that coordination. And then plans for next quarter, digital equity outreach and implementation. Already heard about some of the advocacy. And then the fiscal sponsorship, we're also trying to develop that protocols more broadly so that we can offer that kind of support to smaller local community partners as well. And then the final is just to the expected impacts from this strategy, this strategic priority is to improve the care coordination, data sharing capacity, and advanced digital equity. And the very last slide. This is all thanks to a fantastic team. It's really a pleasure working with all of them. This is us being creative at our last staff retreat, doing painting artwork. Thank you to our wellness, our happy committee. What do we call it?
Fun
Committee. And then John's teaching me how to use AI, so I put together that summary there. That's essentially more for presentation. We've covered all of those numbers, and I will leave it there. So.
Thank you. Any questions for Christine? Or comments? Thank you very much. Well, we are at 3:33, which we have blown through our break. So, 3-minute break,
All right.
a couple of minutes. We'll be back at 3:36, severely. All right, we'll continue to proceed in this meeting. I'll call the meeting back to order after the break. And we have Wendy Bresnik doing the digital equity / telehealth presentation. Is that an hour long?
Yes.
You can save us some time, Wendy. God will buy you coffee and lunch.
Doesn't drink coffee, maybe lunch though.
Lunch. But anyway, no, take the time that you need, Wendy. Thank you.
Thank you. I'll do
Go
my
ahead.
best to catch us up. Just confirm you can see my slides.
Yeah.
All right, and thanks, Ruben, for the shout out. You'll get a lot of that presentation again today. And just so you know, I kept Dr. Sue Kane's name up here because she was supposed to present to me with a rural health conference, but had a conflict and was able to join us. But the back half of these slides, which is digital equity, many of them are hers through the partnership she has with Thriving Together. I'm going to be talking about both programs, telehealth and digital equity, hence the reason it's an hour long. Before I get started, I'm going to throw the slides into chat. So there's a link there that you can grab, and I'm sure Teresa can send them out for those who aren't online. I'm not going to speak to every slide, but I did want you to have them for future reference if you want to dive deeper into this work. So today we'll talk about, let me see if I can get it to go. We'll talk about the telehealth assessment. This work has been going on since 2001, and we have a lot of new board members. So I backed it up a bit all the way to the telehealth assessment so you can see the full timeline of the work we've been doing. We'll talk about the implementation as well as the digital divide. So just to get started, this is where it's all began and the work that you'll be hearing about today. It started with COVID when the board asked us to help our partners to see what we can do to help them with telehealth. And so we kicked off an assessment with Ingenium Health, and from there we've moved into some optimization, some school and library work, expansion through the chart funds that we received. And then that really shone the light on digital equity work and bridging the digital divide. And we got started with a grant from CHNW, and that started in 2022. So that's the timeline of the work that I'll be presenting today. So first, the telehealth assessment. From the beginning, we did a community assessment, but I'll focus on the clinical component of it. Ingenium come in and for those clinical organizations who are interested in participating, there were 8 of them at the time. They met with the senior leadership of the clinical organizations. They did one-on-one meetings, not only with the CEO, but with the C-suite as well, and clinical leadership, the clinicians they met with, and then they did a staff survey. And what they're really trying to ascertain is what was the overall telehealth maturity of the organization. They also looked at their policies, procedures, if they had any in place. So it was a really comprehensive assessment to really calculate the overall telehealth maturity. This is where our organizations fell. There is a QR code to their online telehealth maturity assessment that they've now published on their website. I think it was down the other day, but I know Christian was working on it. So you can see most of our organizations were really in that chaotic emerging area. We did have some that were a little bit further up the continuum, but mostly in the end. And as I talk through the implementation, I'll show you where some of our organizations are at currently. So with that, we asked the board for $2 million to support the build out implementation. We didn't want to just tell these clinical organizations, wow, you're not very mature, and then say goodbye to them. We wanted to make sure that we were offering some technical assistance and opportunities for them to mature their telehealth for the residents of our region. And with that, the board said, yeah, we'll give you the money, but we want to put some guardrails on it. So each of the investments had to have a community initiative, and that's how we got started with both the schools and the libraries. We wanted to make sure there was both a quality, equality and equity. We wanted to make sure it was balanced across the region. We weren't just focused, say, in Wenatchee or Moses Lake, but we were really looking at all the different areas of Okanagan, Chelan, Douglas, and Grant County. And that we were making sure we're not going to give up all the funds to those who said, yes, we're ready right now, and not have any to disperse later on when organizations would be ready. And so we've been able to maintain that over the last few years. We also wanted to make sure that the opportunity was available when clinical organizations were able and ready to participate. So we developed a mission for this work, which has been our guiding star, and that was to improve the health and wellness in the region through telehealth. And our vision was that every resident can easily access all the care they need, where they need, when they need it. That included primary, behavioral, dental, chronic rehab. So we've really been building it out, recognizing that not every patient is a telehealth patient, and not every appointment is a telehealth appointment, but this really is another modality to provide care in our region when we're able to and when it is appropriate. So we took a multi-pronged approach. We likened it to kind of building a bridge. On one side, you have the clinical partners, and on the other side, you have a community. So we had the FQHCs, the rural health clinics, the behavioral health clinics, and the addiction treatment center on one side, and then schools, libraries. We have a fire station involved and a community center that we were having talked to, and we were working these 2 prongs simultaneously. And so that way, as you build both sides, eventually we'll be able to meet them in the middle, and you'll see that in a little bit later. We were developing a model where, as the clinical partners were working on their telehealth maturity and they were able to provide care, they would be able to do it at a digital access point that was agnostic, is how we call it. Many times you'll see in schools, clinical partners have a telehealth presence in a school, but it's only for their organization. And what as we worked with the schools and the libraries, we wanted to make sure that this access point was open to any provider within our region that could provide care, so that I mean, we recognize that students and patrons in the community didn't just see all one provider, that they may have a behavioral health provider, may have one of many of the primary care providers, and they may have a specialty provider, Seattle or Spokane. So really maintaining that it be agnostic was really important to us. We also looked at social services of how we can look at other opportunities so we can continue to keep the framework of the vital conditions in mind. We wanted to make sure that if an individual had an appointment with Social Security or immigration or their attorney, or that they could use these access points to then take care of those, really recognizing that we're breaking down the walls, trying to go upstream, and mitigating some of the issues that are impeding individuals from thriving. We know that with telehealth, not everyone has broadband, not everyone has computers or technology in their home. And when I say not everyone has broadband, they may have broadband where they live, but they may not be able to afford it. So when I say that, there's two caveats to that. And finally, they may not have privacy in their home to be able to conduct a telehealth appointment. So another reason why we were looking at these digital access points. For the clinical component, when through the optimization, Ingenium was working with each of the clinical organizations to look at their entire program, from leadership and governance to virtual care strategy, and how does it tie into their overall strategy of their organization? What do workflows and policies look like? How are their clinicians engaged, employees engaged? And then performance management to ensure that what we are building, that we are seeing the success and we're moving in the direction that we intended to begin with. Some of the stuff that we're working on with the libraries and schools as well can also have some of these components. So what have we done? Just a few of the projects beyond the optimization that we worked on included converting no-shows and cancellation appointments. And that would look like if a patient calls towards the end of, right up to their appointment and say, I can't make it to my appointment because I don't have childcare or my car won't start. The front staff can say, can we convert that to a telehealth appointment? That way the patient is still able to see their clinician, and may not be for the full appointment, but could be able to get some questions answered or a medication refilled whenever it was appropriate. For a no-show, it would be someone who hasn't arrived. The receptionist can give a phone call to the patient or client, and they can say, oh yeah, I forgot about it, but it's too late for me to come, and they can then offer the telehealth appointment in that moment. And that's worked really well for one of our organizations specifically. We've also done some tele-SUD services, some jail telecrisis in the jail. We've worked on teleinterpreter services for the telecrisis, and we've launched services in both the libraries and the schools. So just to make sure we're on track, we did do a baseline assessment. We hired through subcontracted Laurel Health Advisors. They've presented to this board both on the baseline and the supplemental, I believe, assessment that we've done. We have one more assessment that will be completed next year. And we're just waiting for the all payers claim database to catch up. And it's about 18 months out. So we're trying to make sure that when the 2024 data is released, that is when we will work with Seattle King County, who we contract for epidemiology work, to get the data for them to assess the work through 2024 to see how what the telehealth looks like in our region, as well as what disease processes are most utilized by telehealth. And this that information that we've seen in one of the supplementals has been helpful for clinical organizations so that they know systems that they can look at internally of patients that they could refer for telehealth appointments. We are also in the beginning stages of surveying our partners to assess their satisfaction with the work being done within their organization with working with Ingenium, and from their words, the successes that they feel like they have achieved. And some of that will be outlined today, but we're looking for more of the qualitative data. So some of the successes, this is where we're at with telehealth maturity. So you'll see a red dot. That was someone who, an organization who did the assessment from the very beginning, but chose not to participate in optimization. Now, that doesn't mean they haven't been optimizing their telehealth system. That just means they haven't been working with us. Then we have you can see one that was in chaotic that is now in supported. Within a year, they've jumped. We have another one that started last year that's in chaotic that is currently in coordinated and continues. The arrows mean that they are continuing to work with Ingenium to continue to improve and optimize their telehealth. Moving on, we have several organizations that were in that emerging level just because we were in 2020 and many of them had already started developing processes for telehealth. So that put them on the level 1. And you can see their progression, and I've kind of kept the dots color coded so you can see when they started and where they're at. And again, the arrows mean those individuals or those organizations that continue to work with Ingenium to refine their policies and procedures and continue to mature their telehealth. So we're starting to see a lot of progress. On each of the sites, there's a red dot, and the red dot again is those organizations who did the assessment in 2021 but have not engaged with us to do telehealth optimization. It does not mean they are not working on their telehealth. They're just not working with us. Here's the coordinated and supported level. So one was in coordinated, moved up to supported, one's on supported and moved up to integrated. And finally, we have one that was in integrated that's moved up kind of integrated, almost strategic, and then one that was at strategic that was already there. So definitely seen some progress. And there's a method to this. That's why they're kind of in between, because it's just according to points and how your points score you on the different levels according to that methodology. So on the community side, here are all the, we're working with 11 clinical partners across the region, or have worked with them throughout the 3-4 years. We're in 4 emergency departments where we've done the telecrisis. We're 13 school districts, 8 have active access points, 5 are currently in the state's planning stage, and we're in 3 libraries, Leavenworth, George, and Warden. Here are a couple pictures of the libraries. The first 2 pictures on the left are the George Library that opened up a little bit earlier this year. The middle pictures are Warden. It just opened up a couple weeks ago. You see the closed sign because that's when I was there taking a look at it. And they had just completed their training on the scheduling system. So that next week they were opened. I just don't have a current picture. These are 2 telehealth booths. So this is a great option for the library who doesn't have a room to put a telehealth space in. They're 2 different types of booths. So one on the left is ADA accessible. It doesn't have it's very flat from the floor into the booth, but it's very small. I don't have a picture on the inside. Whereas the middle booth has about a 2-inch lip there to get inside the booth, but you can put 2 people in there. So if you have an interpreter that wants to go, or a family member that wants to join the session, they're going to put another stool in there for 2 people. And then finally, the room on the right is the Leavenworth Library. They actually had a closet they were able to clean out, put some soundproofing on the wall, set up a computer section, and it was the first one. It took a while to get that one online just because the scheduling, it was really by word of mouth or kind of within the library. But the library last fall implemented a scheduling system that you can reserve the rooms or the booths electronically through their internet, or you can go into the library and the librarian can help you. And that just started. The Leavenworth Library has just under 80 individuals who've used it since October. The George and Library, we still have some work to do. And of course, the Warden one just started. The library is actively working on their communication plan and how they're going to market it out to the community, not only for telehealth, because we don't want it to be known as a telehealth booth for privacy reasons, but we're also marketing it. It's a place you can do your job interviews. You can have appointments with attorneys or Social Security or every agency does video calls. But we also want to engage that belonging and market it to say, hey, you can do video calls with your family as well, for those individuals who don't have family local and depend on video technology so that they can connect with their family elsewhere. The other thing I will say, the library has found such a lot of success with this that they're going through, it's a 5-year redesign of all of their libraries in the region, and they are really looking at how to include some kind of access point in their space. Soap Lake is currently going through a redesign, and they're looking at a booth that has a 4 to 6 person occupancy. The booths are expensive. For this one man, it's about $20,000. For the 4 to 6 man, it's about $40,000. So there is definitely some expense there they're having to calculate into the overall budget. So what are some of the successes we've experienced? We've designed, engineered, and rolled out proof of concepts in the schools and libraries. 3 schools have found successes with their partners that they're asking for more clinical partners. Our barrier seems to be with our clinical partners, not for the places that have the access points. And these clinical partners are really looking at what does their workflows look like to engage in that. It's just a different way of thinking and a different way of providing care. It's not traditional. And so there's a lot of there's a steep learning curve with that. How are they taking referrals, and how are they getting scheduled, and then the actual telehealth appointment. We've had clinical and community partners who along the way, as you saw along that maturity scale, clinical partners have entered at different time periods. And that's because some of their readiness, they weren't ready. And other times they heard of successes from other agencies and they also wanted to participate. And finally, one of the behavioral health agencies fully embraced telehealth as a strategy of doing work. They included it as part of their line of business, as this is just how we work. Because as they were doing their optimization, they brought all of their staff along, and their staff from all levels was very involved in this. So there was a lot of buy-in that when there was a need that came up, this was telecrisis in the jails, they went to their executive leadership and said, hey, can we fill this gap with telehealth? Because it was already written to their organizational strategy, it wasn't something that they had to plan. It was something that they were just able to shift and start doing, just kind of implement those processes for that particular line of service. And this shows an example in thinking and perception of telehealth and how it's changing that mental model. Many of them, including the executive leadership, were very hesitant of telehealth at the beginning, but have found many successes in it. For the DCRs, this is designated crisis responders. Through the CHART funding that we had received a year and a half ago, one of the lines of service was adding telehealth for their DCRs in the emergency departments. You can see the average response time for the DCR to the emergency department. This was in Grant County, so you can imagine it's a very large geographically. And so if you go from Grand Coulee to Mattawa, it wouldn't be Mattawa, it'd be Quincy, because there's no hospital in Mattawa. And it's only the emergency departments. But you can see the 4 different hospitals and how much their response time was decreased. This is their maximum response time. Also, they saw a reduction in that. And this is where we're doing some surveys of the emergency room staff of their perceptions of telehealth. We have a lot of good anecdotal data from the Behavioral Health Agency, but we wanted to look at the other side of it as well. Some other ones, we've created many cross-sector partnerships. We've increased the seat time for students, those who are using the telehealth. We've decreased drive time for patients, increased and parents who have to pick up their students and take them to the appointments. For our addiction treatment center, we've increased the completion rate for group therapy. We've increased access and removed barriers for patients to attend appointments, and we've decreased cost to patient. I won't read these. You have the link to the presentation, but these are some of the anecdotal quotes that patients have been given that have given leadership about the use of telehealth. So bridging the divide. I know I'm talking fast because we are behind on time. So if I am talking too fast, someone will have to unmute and say slow down. So here we are. So bridging the digital divide. So I will say the caveat and the bridge of this is as we were working on this, digital equity was really percolating to the top and thinking we really need to start to work on it. And CH&W reached out to us. They were receiving a grant or writing a grant to Department of Commerce and wanted to write us in initially for the telehealth work, but then it was expanded for digital navigators and beyond. This began our work with the NCW Tech Alliance. So 1 in 4 people in our region face digital inequities that limit their access to information, education, employment, and healthcare. And our testimony to the legislature over the weekend was really hitting that point. So what does our region look like? So generically, these statistics blew our mind as we were writing the grant last year. With 307,000 is our population, which is about 14,000 square miles. We have about 21.5 persons per square mile. We are 20% of the state geographically and 3.9% of the state's population. So very large geographically, very small population. 35% of our population are Latinos, 32.5% are less than 150% of the poverty, and 17% are 65-year-olds. We pulled out three statistics because the data show us these are the 3 populations that tend to have the experience the most inequity. In general, according to the census data, 26% of our households are without a desktop or laptop computer. 19.6% are without an internet subscription or broadband of any type. And as I noted earlier, that could be because they can't afford it or it's just not in their area quite yet. And 41% are not using internet at broadband speed. So we began working with the NCW Tech Alliance. If you're not familiar with them, I'll throw their link in the chat. They're an organization out of Chelan, but they cover the same region we do, Chelan, Douglas, Grant, and Okanagan. They also cover parts of Adams County. They're in Othello, not much in Rootsville. But their mission is to bring people and resources together to support technology adoption and digital inclusion. We have worked hand in hand on a lot of the work that I'm about to present to you now. I'm going to leave this video in. It's in the presentation. You can watch it. This was a video that was developed to really show what the digital divide looks like in North Central Washington, but you can watch that if you're interested on your own time. So we look at digital empowerment. We look at it as a three-prong stool. Individuals need to have connection. They need that physical equipment, the service infrastructure, the internet, fiber, cable, satellite, the cell towers, all that physical infrastructure needed. They need devices, and that's affordable, quality internet, and internet-enabled smartphones or computers. But they also need the skills. It doesn't matter if you have a computer if you don't know how to use it. Sorry, clicking on screen. So what does the digital empowerment journey look like? This is just kind of a quick, and this is distilled down to really very simplistic. And I know life does not work with this, but it has worked to some capacity in our area already. When you have someone who has a dream of maybe starting their own business, but they don't necessarily understand how to get started or know how to, don't have the digital skills, they'll attend one of the digital literacy classes, which will really help them navigate, understand how to turn on a computer, how to navigate the computer, how to send emails, who to connect with. It's some very, very basic digital literacy. And with these newfound skills, they can go online and start to look at how to open a small business and to create a business plan. This person can then use her digital literacy skills to leverage the technology that she now has to start building out her small business plan, create a website, and launch her own company. Depending on what type of company this person has, they will begin to employ additional individuals and really improve the economy of the community that she lives in. So that digital literacy, that digital empowerment is really an economic driver along with other things as well for our communities. So what is digital equity? Digital equity means ensuring that everyone has equal access to technology, the internet, and digital literacy skills. It's pretty basic, but we found that the Tech Alliance was at some pop-up events and went around and asked, what does digital equity mean to you? I did not include that video because it's quite amusing. I just don't want to embarrass some of the individuals in it, because it went everyone from Bitcoins to gold to just really out there definitions of what digital equity is versus really what it's really honed down to is the equal access to technology, internet, and skills. I'll flip through these slides really quickly. We wanted to lay the groundwork in data. We want to be able to tell the story about the regional access in a way that comes off the page. And so we created the equity plan for the state. These are all county level reports that connected this overall systems issue of digital equity or inequity in our region, and showed the different county level connections. If we were able to pull this together, we can change the mental model that people in our communities hold about how this problem is impacting our neighbors and how they can start to see opportunities to change. So I pulled them out and I have these digital equity plans. I'll throw those in the chat as well if you're interested. There's more to it. They're on this website, but the actual link to the plan is here. Hopefully that will get you to it. But they're really fascinating. It's a nice booklet that was put together by the Tech Alliance. You can see the internet speeds, and those are that was from the Department of Commerce. They have a I don't know, widget or something on their website that you can, from anywhere within the state, you can go in and look at your upload and download speeds. And this is what our region looks like. And finally, here is Grant County. Grant County's made significant progress. At the time of this, I think they were 97% built out, but now they are 100% built out as of December 31st, 2024. However, you'll see that there's only a 66% adoption rate. Again, that's because of affordability of the internet, or it could be that they just don't want it. Some households don't want internet at all, and that's fine. We also see that 17% of households lack internet service and 28% are without a desktop or laptop. These issues are more pronounced in our low-income and minority communities such as Warden, where the devices are much more limited. So through those digital equity plans, there were already a broadband action team in Chelan County, as well as one in Okanogan County. And they came together to create their digital equity plan for their area. And then we kind of came together as a region and pulled those equity plans as one holistic regional response so that we can look at it as an entire ecosystem. So the Digital Access and Equity Coalition was formed in 2023 and has a lot of different individuals involved. Some of our goals across the network of partners span public schools, public services schools, community-based organizations, and volunteers. We convene 4 times a year virtually to align priorities, and more recently for the legislative agenda. We're seeking to enhance access for covered and underserved population, increase the visibility of digital equity work, and share knowledge and collaborate with each other and look for opportunities to improve funding. So currently there's 700 registered to receive updates about the coalition. This coalition is known around the state. We have gotten attention of the Department of Corrections, the State Board of Community and Technical Colleges, the Washington Student Achievement, as well as the Northwest Regional Telehealth Center that's out of Utah that covers the Utah, Montana, Wyoming, Idaho, Washington, Idaho, Oregon, Alaska, I believe is the region. As well as legislators who would champion the digital equity work, Representative Gregerson and Representative Slater. We have 80 organizations that have actively participated in the regional coalition. And through this work, the Tech Alliance has met with 11 different legislators or policymakers, engaged with them to share the issues that are brought up during these coalition meetings, including the 9 legislators from districts 7, 12, and 13. For those on the coalition call who are interested, we receive I don't want to say it was weekly. It was weekly in the beginning. Now it's as needed email that really looks at the regional legislative advocacy and how to engage. As you can see, it informs of when a bill will be open for public hearing or as an executive session. It gives you a summary of the bill and it'll update the progress and what opportunity individuals can engage. This helps them exercise their civic muscle. All the links are there. It's very easy to get the email and then click when appropriate. Another thing we did, you have 12 months in a year, and because we can, designated September as Digital Equity Month. It's not anywhere else in the world, I don't think, but it is in North Central Washington, and we celebrate it. Let me go back, have a lot of different opportunities that go on during this month, including, oh, that's a wrong slide in a wrong place. How about that one? Sorry, didn't delete that slide out. What we've done there were 2 events in Okanagan, 2 in Douglas County, 4 in Chelan County, 6 in Grant County, 5 regionally. Different types of events that went on. It was not all done by the Tech Alliance. During this month, we asked organizations across our region, thinking of all those organizations in the coalition, to make a commitment to digital equity. And through that, we've had 52 commitments that came in, and we celebrated those in the month of September. Many of those commitment makers are the ones who were offering events during Digital Equity Month. You can see they're pretty balanced across the region, and we recognize them. You can see Thriving Together also did our commitment, and that is how we celebrated at the Tech and Trailblazer event at PIBUS last September. We also had city governments, 9 of them, say that they would make a commitment to digital equity to ensure the residents of their towns have the information needed from a city standpoint to be more inclusive and to be ensured that they're not left out. Here are some of the digital equity commitment makers. It's exciting to see small business owners on here, community-based organizations, school districts, public service providers, and others. Through the funding we allocated to the Tech Alliance, micro grant pool was created, and these additional resources were offered to organizations who were interested in taking action, and that was some of those that were offered during the Digital Equity Month, Digital Equity Month, or afterwards that were much more long-term. There were 15 grant applications that went out indicating support. So this is the Tech and Trailblazer event on September 10th, where we invited all those commitment makers together to celebrate with us, to network and connect in person. This actually was interesting because we were able to display them across the room. You can see them in the pictures. And for those individuals that came, just a couple of months ago, someone wanted to do an event up in Okanagan County, and they reached out to Dr. Sue Kane and said, please help me connect with other commitment makers in Okanagan County so that we can partner together to offer this digital literacy opportunity to our residents. So it was really cool to see unlikely partners come together around a shared objective, bridging the digital divide. I'm not going to read through all these commitments. They're in the presentation. Consider the vital conditions that are being addressed, such as meaningful work and wealth, advancing belonging, lifelong learning. You'll also notice that there's a focus on specific populations like the underserved, individuals with disabilities, entrepreneurs, senior population, students, patients. There's just a lot of good work with each organization. You can see that they are targeting their specific population, which is what we've asked. We're utilizing a collective impact model where the goal is to bridge the digital divide, and organizations are doing what they need to do to reach their population. So it looks different for each one. It could be setting up a computer station at a coffee shop, or it could be assessing their patient portals, such as MyChart and Epic. Engaging the community, advancing digital inclusion through policy. So creating policies that effectively change how an organization regularly does business. If we can, again, change those models, then we're making system change as we move forward. Using data for digital inclusion. And I would say that this collective effort is amplifying our reach, engaging communities, and raising awareness about the importance of digital inclusion. The broad participation demonstrates strong support and ongoing momentum for digital equity initiatives. And you can see the regional commitments that together reflect this, create a more inclusive and connected community, ensuring that everyone, regardless of background or location, has the tools and opportunities needed to live, work, and find joy in North Central Washington. So this next piece of work, skilling and device programs, again, started with the Department of Commerce grant that was through the Community Health Network of Washington and filtered down to our region. Some of it was our funding directly, and some of it was the Community Health Network of Washington's funding. Some tech help pop-up events. So you go to the local fairs, there's a booth there to help with immediate technology needs. They're becoming more coordinated, and say like the second Tuesday of the month, they may be at a specific senior center. So they're looking at how they can be more consistent in communities, because if you go to a fair, you're not thinking about talking about your technology needs. It also would give them information of where to reach out if they need help. We did write a federal grant last year, the NTIA grant. It was for $13 million that would help fund some digital navigators sparse throughout the region as well. The Tech Alliance, through their own funding, has a community computer refurbishment program. So they get computers from schools or hospitals. They refurbish them to factory settings. They have a certification that says, because there's some HIPAA that you have to be aware of, that they are wiping it off of the hard drives. They use volunteers then to completely refurbish these computers, and from there they send them right back out into our region. So they're not being sent elsewhere. They're given to those individuals who are in need. In addition, there's some community skills and digital literacy classes. These are 4-week classes. They're in the evening. They're in person, and it's amazing to see these individuals go through these classes, and they learn to how to use a computer, how to open it, how to set it up, how to send an email, some very basic things. And then there's a graduation at the end. It's one of those events. I've been to a few of those graduations that they just make your cheeks hurt because you smile so much, because you see the gratitude and you see how much it has changed the lives of individuals that are in the room. They also, cohorts are funded to give a computer. So CH&W, Microsoft, and we funded one cohort. The computers were all brand new. They started day one on a computer, and they had that same computer throughout their time, those 4 weeks, twice a week. And at the graduation day, they were able to then take those computers home if they had done all of the trainings. So it is a life-changing event. Cohorts are chosen based on the data I was showing you earlier in the equity plan, using census data of where the most need is, so that they've hotspotted that data to really identify those communities. So in addition, we have some digital navigator trainings. I forgot to put this link in the chat, which I'll do. Sorry, this was back with the commitments campaign. But we have some digital navigator resources as well. Those trainings are online. This is an old screenshot, but they do some synchronously online, and these are for individuals who are computer literate that want to help individuals with their digital literacy. So it's not for, so because it's online, it gets a little confusing there. But it is an opportunity of how do you help adult learners learn how to use the internet. Our model is different than around the state and frankly, many parts of the country where they want to train a digital navigator. So you may have one or two in a county, and either individuals have to come to the digital navigator or the digital navigator has to go to the people. And if you can imagine with the geographic landscape that we have, people are not getting their needs met. We have decided that we want to train individuals or upskill them. The individuals who are already getting questions about how to use the computer or how to do certain things. So your receptionist at your clinic may ask, how do you use my chart? Having the skills to teach an adult learner how to use it is what these trainings are about. That's the basic training. There's the synchronous one, but there's also an asynchronous online one that has been offered. In addition, every month there's a advanced training that has advanced topics such as AI tools or school portals or other patient portals. So I'll put a couple links of some resources that are available there. So this is the online digital access, the digital navigator at basic and advanced courses. You can find them at the Tech Help website. Just some data on the trainings we've done. We've trained 183 different individuals in the live and asynchronous classes. 183 registrations, 155 were unique individuals that participated. 183 for the basics, live and asynchronous classes, 155 unique individuals for the advanced topics classes, and 106 of those came from our region. And there's a bigger slide that kind of shows you the numbers of each county. So here's some of the different classes. This was the in-person basics class that was originally offered. They're not doing many of those just because of cost. But you can see the diversity in age and ethnicity in those classes. NCW Tech Help, I put that website in the chat already, is a great resource and is available for everyone around our region. There's also the Digital Navigator Guide, the Digital Equity Plan. Those are all resources available on that website that we share with our community. You're welcome to take it back to your organization and share there or to your networks. So why approach digital inclusion work as systems change work? It's very interconnected, it's resourceful, it's sustainable, and it's scalable. So we want to think about how does this system change work with resonate with you, and how is this work you're leading, engaging deeper levers of more sustainable change in the region. And with that, I am done. I'm not sure if I caught up on time, but I do need some water. I'll take any questions if you have any.
Thank you so much. Any questions for Wendy while she takes a sip of water? Anybody, any comments? We appreciate your work, and yes, you did a great job of catching us up.
Emilio said I owe you.
Yes, he's taking us both out to lunch.
Emilio, I will make sure I hold him to that one.
Thank you so much. I really appreciate that. And with that said, let me see on the schedule. We have now the network update with Veronica Farias and Mariah Kelly. And you don't have too much time to make up.
No,
So
and
you're
I
good.
was actually out of breath for Wendy. So I took my sip of water before. I have a slide deck that Caroline will be sharing as well. But I'll just jump in and start while there it is. So I've been leading our organization's network development for the past year and a half, almost two. And today I'll provide an overview of what these efforts look like. So you can jump to the next slide, Caroline. So my network update consists of an overview of our regional work groups, I will highlight a few network members to get a closer look at who they are, what they do, and how we're supporting some of their individual work. I will provide an overview of our upcoming network events and opportunities for 2025, and then highlight some exclusive network benefits that have been in the works this first quarter. Kristen alluded to some of these in her strategic update. And then finally, we will get a preview of what's ahead with our CHI alignment process, and then a Catchify report that highlights the resources impact on our network partners. Next slide. So to start off, I'd like to revisit where this regional network vision came from. The regional work group of partners across various sectors has evolved throughout the past few years. And the Stewardship Council, we continue to meet every other month, and it consists of different board members, CHI leads, and other network partners. Most recently, we welcomed Sarah's Shared Measurement Task Force to the group, and we've merged both work groups, although we're still called the Stewardship Council. This group of partners, they've been guiding the vision of this network, and we continue to leverage the partner agreement as a key component of this regional movement. Our coalitions for health improvement, or our CHIs, they remain strong. They're independent local coalitions. They are rooted in their individual communities. And at the same time, we've been actively working to seek ways to strengthen our relationships, foster collaboration across county lines, and just support each coalition's unique efforts as they lean into the vital conditions framework as well. Next slide. So I'm excited to share that we do have 59 network partners that have officially joined and have committed to the partner agreement. Since the beginning of the year, we welcomed a few partners in their organizations. And when partners self-select and join the network, they're asked to reflect on which vital conditions they're influencing in their day-to-day work. We also asked them why they decided to become a part of the network, and how they plan to contribute as either individuals or on behalf of their organizations. And I'd love to share just a few of these responses with you, because I believe they just beautifully capture the diverse perspectives and passions that our partners bring, particularly from their unique areas of work. So the first quote that I have is, "We're committed to transportation equity and environmental justice, helping families access jobs, education, and healthcare. Our multimodal solutions reduce cost burdens, improve air quality, and meet real community needs. I'm excited to join the Thriving Together network to help advance reliable transportation for all Central Washington." The second quote is, "We began as a traditional donkey rescue and sanctuary, but 3 years ago, we partnered with Sarah Fox and her nature immersion program using equine assisted learning to support social emotional development. That's when I realized we can do so much more. Our donkeys have the power to support mental health, conflict resolution, emotional intelligence, education, and more in our community." And then the last quote is from the Wenatchee River Institute, and they said, "At the Wenatchee River Institute, we connect people, communities, and nature through environmental education, supporting a thriving natural world and lifelong learning. We joined the Thriving Together network because collaboration amplifies impact. We are committed to sharing our platform, building partnerships, and taking action to support our community." Next slide, Caroline, thank you. So as we look forward to the rest of the year for the network, we have various opportunities lined up, including a series of learning sessions. We kick off next week, as Kristen said, with our first learning session of the year. It will be focused on belonging and civic muscle. For the month of May, we're planning for our second virtual session highlighting food as a multi-solver. And in July and September, we will offer a deeper dive into our tribal learning journey and thriving natural world. Just to clarify, these topics stemmed out of last year's summit. If you read our summit report, these key themes will be familiar to you because they were captured as the collective vision and priorities of those who participated. And then finally, we will start planning our second annual summit here soon, and that will take place again in October. You probably noticed I skipped the regional facilitation support at the bottom in May and the vital conditions grant in July, and that was intentional because I have a separate slide for that, but I still wanted to include it in the visual for the year. Next slide. So earlier I shared, and so did Kristen, that we've been working on 2 new and exclusive network benefits since the start of the year. And we're excited to share that the Vital Conditions investments will provide grant opportunities ranging from $10,000 to $40,000 or somewhere in between for network partners. To ensure these investments reflect community priorities, we're also forming a Vital Conditions Review Committee. It's made up of network partners, so the closest people to the work are helping identify the upstream solutions and co-creating how these resources are allocated. We are aiming to open applications in July, though we're still in the planning phase, so timelines might shift slightly. And then the second benefit we're rolling out may be smaller in scale, but we do believe that it will have a significant and impactful or meaningful impact. We're partnering with Sage Step Consulting to offer regional facilitation support, making accessible facilitation available to our network members and their initiatives. So whether partners are launching a new collaboration or navigating complex conversations, this resource is designed to strengthen and empower the efforts of our network members. And we're aiming to have this opportunity available later this spring, so stay tuned. So we've continued our partnership with community initiatives this year who play a key role in providing strategic direction for the development of our network. Recently, they've been supporting our regional alignment process for the coalitions for health improvement. And then, John, I'll hand it over to you so you can cover Monty's part of the presentation.
Yep,
Go to the next slide, Caroline.
Next slide. So ultimately, as we continue to refine and get our network into kind of this implementation growth maintenance phase, as the chives continue to grow and evolve themselves, we've really seen both of these as an integral part of the network. So what we do under really our thriving networking vital conditions and how the coalitions for health improvement engage their localized members in this work are really interconnected. And in some ways, we've managed to have some of those conversations collectively together. Some ways, they've still been kind of operating on parallel tracks instead of linking more together. And so our goal this first half of this year is really to spend time with each of the coalitions for health improvement. And Ryan and Ruben, thank you for being part of these conversations already and continuing to be part of these conversations to figure out how we really look at how all this work really intersects together. You know, one of the things I've been telling everyone as we start to engage in these conversations, I want us to really, as a thriving together network and coalitions for health improvement, to be able to come together and give a value proposition on how we're collectively supporting the health and well-being of our community members, whether it's to the board or in the future, if we continue to look at funding to support this work, how we collectively come together to look at other funding sources that could support this work. But in a lot of ways, they're partners in this work, but they're also part of the fabric of this network as well. And so we want to spend some focused time this next year getting a better understanding of how this is interwoven together. I guess if you go to the next slide. And so we're going to be engaging with community initiatives to help facilitate discussions with coalitions for health improvement with us and collectively together to start really aligning and coming up with a sense for these discussions. We really wanted community initiatives to do it really as kind of that facilitator outside support. So even our team could participate kind of at that regional network level as that perspective, while each coalition for health improvement was able to participate at their own, in their own network. And it wasn't getting tugged or pulled from one of us having to participate and facilitate at the same time. And they're gonna really guide us into some of these directions with the hope mid-year that we can come back and really share mid-year or Q3, I'll say, just in case, because things take longer. Share some of our insights and thoughts with the board for moving forward in this work in 2026. And I guess I'd open space. I know Ryan and Ruben, I didn't prompt you to speak or say anything, but I'd open up any space if either of the two of you wanted to make any comments on this. You can say no, or you can stay, I'll take stay on mute as no.
Ladies first, but
She shook her head at you.
I think, no, this is wonderful. So I think 2 years ago when Veronica and I were sitting down talking a little bit about how we weave the network between the Chai Thriving Together and all our community partners and members, I think has really led to this moment where we're continuing to look at how we look at advocacy together, how we cross those county lines between the Chais, and how we can learn from each other. And so I think a lot of that's been happening kind of organically over the last year or so. But it's really exciting to see Thriving Together taking the opportunity to kind of cultivate that going forward.
I agree with Ruben. Thank you, Ruben, for going first. I would just echo too that, the work that we did through the legislative steering committee and just some of those things where all of us are kind of overlapping, they were all really good opportunities for us to work closer alongside each other and just for you all to be capitalizing on this opportunity for us to continue to co-collaborate and work across our large region is pretty awesome. So I think that we had a great conversation to start with last year at our lengthy all Chai gathering, which was awesome. But even for this to take a more directive approach, I think will be super beneficial for all of us.
So more to come to the board, but really just wanted to emphasize, we feel this is kind of the perfect timing and evolution to engage into this conversation. And if you go to the next slide, I will turn it back to the team.
Can everyone hear me? I think one of my headphones gave out.
We can hear you.
Okay, sweet. So finally, before we dive into the Catch a Fire report, I wanted to offer a reminder as to why we went with this resource. We strategically chose Catch a Fire as a network benefit, not only to provide value to our existing partners, but also to drive network growth. By offering Catch a Fire as a network resource, we empower our members with access support in different areas like marketing, strategy, operations. This allows our members to focus on what they do best, while experts can help them tackle their projects outside of their organization's capacities. The inclusion of Catch a Fire is also a key component, as I mentioned, of our strategy to attract new members to the network. And it's a unique value proposition that demonstrates our commitment to providing practical tools and resources that directly enhance our partners' work. By showcasing these tangible benefits of Catch a Fire, we're not only offering or helping current members thrive, but also encouraging new organizations to join and take full advantage of this powerful resource and the movement that we're creating across the region. So Mariah, I'll let you take it from here.
Great. Thank you for that intro. I'm going to let Caroline pull up the slides. I hope everyone can hear me okay. Is there a lag?
Very good.
I'm in Orville, that Okanagan County broadband. We're putting it to work right now. So Caroline's going to pull up the proposal we received from Catch a Fire. Veronica, John, and I met with Tori on Thursday, and we're sharing the information that was just shared out with us to inform the board and move forward with planning for year 2. Thank you, Caroline. Okay, so if you can move to the next slide. So as Veronica mentioned what Catch a Fire does, so I won't provide too much more on that. We have
33 organizations that are currently registered and 77 total matches have been provided. And as you can see, that equates to a $278,323 impact. And those numbers down there with the total hours donated equivalent to 29 work weeks. We had some questions because you'll see on the next slide, how in the heck do they calculate these numbers? So they provided us with a kind of that project value, and they do that on an hourly rate and estimated hours, that both with the validated cost for project scoping and that talent sourcing. So that is where they get those numbers on the cost savings for our members that are utilizing Catch a Fire. Next slide, please. So when network members are enrolled in the Catch a Fire platform, they get to select the communities that their organization serves. So as you can see from this graph, that the low-income communities are receiving extensive support. And next is the immigrants or refugees, and children or youth comes in third. Next slide, please. Our group that has the most projects through Catch a Fire is the Women's Resource Center, and they have had 965 hours donated to them. Angie has provided this testimonial. Posting their projects is a simple, user-friendly process, and there is no shortage of volunteers. The system is straightforward and will be a great advantage to our organization. Grateful for Catch a Fire. We are having all client documents translated to Spanish so that we can serve our homeless Hispanic population in their best interest. And you can see there that they have completed 36 projects, and that includes the translation and some storytelling as well. So they are the super users of the Catch a Fire platform. Next slide, please. We also have access to the cause area. So across the cohort, this is, and it makes sense, that health and nutrition and human services and education would be at the top of the list. Next slide, please. Here is another testimonial. Our experience with Catch a Fire has been a great experience. The platform has connected us with skilled volunteers who have provided expertise in areas of fundraising. The support has been seamless, and the personalized assistance has made it easy to find the right volunteers for our needs. One has become a board member, and 2 have become lead volunteers, where they help us find more volunteers. And that is from Mary Chuy from Unidas Nueva Alianza. Nueva Alianza. I did not say that well. Una. Comparing engagement over time, this just shows the growth that we've had since we adopted the program. So we are still running on a fiscal year, so we're still in that first year, and you can just see that huge increase that we experienced as we, onboarded folks back in August all the way up to now, where there's many more active organizations, with 33 being the current number. Next slide, please. And this was just kind of a vision for the continued collaboration as we work with Catch a Fire. Can you go ahead and jump to the next slide? I was wanting to just kind of move forward. Okay, and then the Nonprofit Community Center is something that is coming down the line, and it's going to allow nonprofits to learn from each other's experiences. And I believe Tori shared out that this is going to be active very soon. So they're really excited about this, this community center. And if you can move to the next. So this is where I kind of wanted to jump ahead to. The grow plan is kind of the idea as we move into year 2. So this, as you can see, will be $115,000, and it includes all of the essentials that we would need. So we have already decided that this is something we want to continue. As you can see from the testimonials we received, our network partners think this is a wonderful thing, and this is definitely, as Veronica mentioned, helping us to expand our reach and get new network partners. So this is what we will receive for that cost. So I'll let you take a look at that. And if there's any questions,
And Mariah, this was also the current plan we were on this year, so this was the rate for this year. The way that we initiated it, as Mariah and Veronica were saying, is we utilize this as a network benefit. And so we anticipated it to start small and grow, so we would only anticipate that ROI to grow over the course of the second year as well.
thank you, John. Great, and here are the next steps. So we just discussed this with Tori last Thursday. We're reporting out today. We're hoping to get going on signing a statement of work, and then that program year 2 would launch in July. And that concludes. I don't know if there's any other questions. And Veronica and John, please chime in if there's anything else you want to mention.
It's a good recap of what we've been working with in Catch a Fire. Thank you for covering, Mariah.
And we are right back on time.
Yeah, my lunch too, he said.
We'll just make it an all staff.
Thank you. Thank you, appreciate that, and great presentation. Comments, questions from anybody? Wonderful, looking forward to hearing more about Catch a Fire and how it all connects into the way we're trying to strengthen our system in our North Central Washington. Appreciate that. With that said, we get into the part where the board has the final thoughts, inspiration, encouragement, motivation, word of the day. The floor is open. Manuel, you look like you want to say something.
I always just appreciate the lot of work that the team does, and not only day to day, but then also taking the diligence to put together excellent updates for the board. So thank you.
Yeah, I echo that as well. Anybody else, any other thoughts, questions?
I was just gonna say, I'll echo that too, Manuel. Really a great presentation today.
Thank you, and appreciate the staff for catching us up and making lunch, making John pay for lunch. So we appreciate that. Well, without further ado, unless anybody has anything pressing, we will consider this meeting adjourned. Thank you, and see you next time, everybody. Enjoy, stay safe.
Thank
Thanks,
you all.
everyone.
And Wendy's gonna stay on, but we're
And
gonna.
when you did your text?
Yeah.
Cool.